Okay, you guys, if you were just here for the clinical assessment lecture and you're jumping over here to the mini mental status exam, if you then you'll recall this part that I had just lectured on. If you don't, you may want to kind of skim through the video to see that stuff, because I'm not going to repeat this, but this is the gist of what we're talking about today. One thing I will repeat as I pull up all these different resources is the whole point of a mini mental status exam is to check on the status, specifically the mental status, in a very mini or short abbreviated way. When I say it that way, it seems kind of obvious, but the idea is we take a snapshot of a person and how we observe them. It's essentially just an observational tool that we have, and it's supposed to be quick and efficient, and most importantly, accurate and descriptive. That's the kind of the key thing here. So the reason I have this PDF and all these other PDFs, I'm going to walk through a bunch of these different things. The reason I have a bunch of, not that one, ignore that one. The reason I have a bunch of these different things up and open is because I don't think there is one standardized way to do a mini mental status exam. The tool that you see in front of you is probably the most common, and also I don't use this one, and I think it's maybe the most misleading for what we do as counselors. So the reason I say that is because when you see another person and you make a short, quick observation of what you're seeing, all of those observations are going to be seen through our own lens, our own understanding, and most importantly, the words we have in our mental dictionary to describe other people. This tool right here, it has this point system, and it's supposed to make it a little bit more objective and less subjective. In other words, make it follow this sort of scientific process to reduce bias. And yet at the same time, it doesn't really capture as much as we can doing this in our recognizing the limitation of our own language. So this is probably a little confusing the way I'm explaining it. But what our goal here is, what we're really trying to do is we're trying to understand what are the terms that we can use to describe people given these various different categories. So if I go back to this one, these are really generic categories that get brought up in many different kinds of explanations of how to do mini mental status exams. But this is not all of them, and you may not even use all of them depending on how much time you have and what you're trying to describe. So hold on to what I'm saying here, because it'll all come together here in just a few minutes. But the reason I have all these different resources is because, and I'll come back to this one in a second. The reason I have all of these is because they all talk about the mini mental status exam slightly differently. They show different categories, and most importantly, they show you different language that you can use to describe different conditions. The task of what you want to try and do and what practice you want to get is essentially just expanding your dictionary or the diction that you use to describe other people and their behavior. So you'll see these in different examples in just a second. Now I'm bouncing back and forth a little bit, but what you see in front of you is something that typically gets used, I think, mostly by people who are looking for a different kind of information than we often do. So what I mean by that is that what kind of information would you as a counselor glean from whether a person knows what year it is? If you said, okay, client who just walked in to talk about their stressful husband or their kids who are having a hard time at school, and you said, tell me what year you think it is. And they said, well, it's 2025, because at the time of this recording, it is 2025. And you're like, okay, 1 point. Okay, great. And then you go down through all these things and you're like, okay, they just told me they want to talk about something that's going on with their kids. And I'm asking them these questions about name 3 objects, taking 1 second to say each. Then you follow these instructions, that you haven't walked through these things. And essentially what you're doing is, in my understanding anyway, is you're trying to rule out neurological conditions or dysfunctions or something like that. Things with like attention or recall of 3 objects or language, like, do they understand these things? Do they, if they have to draw these pictures, what we're trying to capture here is just something completely different, not completely, but something pretty different than what we actually do in our counseling work. See, I see this thing from time to time, and I've asked various different people of like, okay, so what information do you gather from this thing? Because I see it used quite a bit, and most of the time I don't get answers that really help me feel confident that people are using this really intentionally. It's like I just had to do it because someone told me to or whatever. So if you see something like this, the question you should be asking yourself is, what information does this give me? And if it gives me important stuff, then use it. If it doesn't, then don't use it. If you have to use it because someone's making you use it, then use it, but don't make it a big deal with the client and try and get it over as fast as possible, right? Like, do a good job on it. Don't just be dismissive, but also recognize the value it's bringing you. So I want to show you this one because I see it so often, but it's also kind of useless. I shouldn't say that. It's not useless. It's not giving us as counselors, given our kind of work, what is really the most valuable. So sorry, I misspoke. Something like this, though, does provide a little bit more assistance. I'm not going to read this to you. You can take this if you want. If you want to download any of these or none of these, or you have your own version, this is totally fine. So I literally went out, did a Google search, found several different versions of things that I thought were helpful, and there were many, many more resources. And I just pulled some of these to show you, but there's so much more. You don't have to follow any one of these specific things. But notice the categories: general appearance, behavior, speech. Sort of fits what I showed you that was in our textbook, also on the slides before. And in these different categories, it's helping say what kind of questions or what kind of words describe things like appearance. And there's these subcategories even. Is it appearance meaning clothing? Is it appearance meaning body build? Is it appearance meaning cosmetics? There's all kinds of different information or questions that we can be asking ourselves that can help us here. Now, before I go any further, the thing that may be helpful for you to not get completely overwhelmed is when you're doing your counseling work, sometimes someone walks in and you're like, do I have to ask all these questions or consider all of these different words and say, well, how about their eye contact? Do I need to talk about that? Well, here's the advice that I give you. Talk about it if it's clinically relevant. I know that's not super helpful because that could mean so many different things, because then you may ask, what the heck is clinically relevant? As you get more experience, as you get more practice, you'll start to pick up on little tiny things, little nuanced things that people do that are indicative of certain kinds of conditions or behaviors or experiences that people have. Like, for example, if you're working with adolescents and, kind of a school adjacent program for students that are not doing well in their classes, have behavioral things going on, you might be a much more accurate observer of people's body language, like defensive body language or slouching or things that teenagers do, some of which may be completely part of the normal teenage experience. I was a sloucher. I was also kind of an angry, sad, disgruntled teenager or angstful teenager or whatever, So what's the difference between normal slouching and angry, angstful slouching? You might become much more observant than I would, for example. So what's clinically relevant? I might misunderstand a certain kind of body language, whereas you have a say, oh, this is the slouch of a kid who's sad, or this is the slouch of a kid who's angry, or something like that. So what is clinically relevant will become much more part of your process as you do your internships and get your first couple of years of experience, and depending on what kind of things you're working on. So you look at these lists. What I would suggest with these lists, and I'll show you some of the other ones, is I would probably just print them off, or not print them off, but like download them to your computer, keep them around. And as we're working on our projects, or you are going through your first couple of years of supervision, just keep them around a little bit and kind of refer back to them once in a while, just to sort of enhance your vocabulary a little bit. Because I don't know that I would think to talk about their gait in terms of like how they're walking and the smoothness of their walking as brisk, but that is a really descriptive word, because the point of an MMSE is, if I'm going to be talking, writing this down to communicate to either future self or other providers, if I want to give a snapshot that is as accurate and descriptive, almost poetically so, that can tell people exactly what you should know that's clinically relevant about a person, and I said, this person has a brisk gait, you'd probably conjure up an image in your mind of what does a brisk gait mean, and it might sort of say, okay, well, the diagnostician in me is thinking a brisk gait. This is not somebody who's depressed, right? They're not going to be walking briskly if they're depressed, probably. It's not to say that people don't have sort of high functioning versions of depression that maybe, say, in men might look more like anger, in which case a person might be depressed, but they're furious and they're angry and they're coming in to talk to you about something. I don't want to come in with my wife dragged me in here. I don't want to. So you might say they have a brisk gait, right? But in context of all the other information, it might describe something about who they are and how they are. So take a step back here. What we're looking at here is just a whole bunch of different words that describe a person's behavior or their speech. And what we're going to do is we're going to say, do I have to say somebody's talking slowly or quickly if they're coming in to talk about their stressors with work? Well, if it's relevant to a potential diagnosis or if it's relevant to their specific condition, then maybe, right? If somebody's just a slow talker and it's not related to after we get to meet them and know them and we find out they just always talk this way, it's not indicative of a clinical condition, then do I need to write that down? Probably not, right? Like we get to sort of use our heads and say, is this just part of who they are at the best of times or in their healthiest way or just part of their character? Then it may not be relevant to say all these words. What we can do now is just get some practice trying out new words and practicing being descriptive. So feel free to try to use a little bit more language. But again, in future, when you're doing your diagnostic process, making your progress notes for the purposes of record keeping, you're going to need to be quick and efficient at this. And so you're probably not going to have time to say like, well, let me consider their rate of speech. Let me find exactly the right word. You're just not going to do that in most cases. So right now we're practicing. We're looking through all these different categories of different questions and different language to understand different ways of seeing people, only to later on get really efficient with our process here. So I still come back to these kind of things and say, what might I be missing here? Just because I'm stressed and I'm trying to be fast and trying to be efficient and glossing over things. Sometimes I forcefully tell myself, let's slow down and learn a little bit of something here, just to make sure that I'm staying fresh, that kind of thing. So there's a whole bunch of stuff in here. I'm not going to go through all of this, but some of these are really kind of interesting. See if there's anything that jumps out at me. Not really on this one. For this one, let's look at another one here real quick. This one has different categories, I guess, even sort of more categories. They split up mood and affect because there's some that you have to ask about and some that you can see on the outside, and they split them up just for the sake of understanding here. But again, more questions and more language, speech and language. This person was talkative, spontaneous, expansive, paucity, in which they're not really giving you information. That's a big word that some people don't like the word moist, and this word is one of those that just gives me like a physical reaction. I learned it when I was in doc school, and it drove me nuts when I'd read a paper and people would say, there's a paucity of evidence. It was like this academic thing that came up in research and nowhere else. I was like, nobody uses that word except for us nerds that write papers. But it just means there's a lack of, or people don't use a lot of language in terms of the quantity of their speech. Just they're not saying a whole lot, And I think there's easier ways to say that. This is a good point probably to bring up this idea that you can use big words. You can save if you're super smart and you know lots of words and you're like, my poetic challenge is to find exactly the right word just to describe this person's condition. But if nobody else knows what that word means, like paucity, outside of a bunch of academics writing papers, then it's not really going to communicate the message. It's not going to give another person that mental picture of what the person's status is. So consider who your audience is here too, not just your own language and your ability to prove to yourself or other people that you're really smart. So as I say, we want to expand our vocabulary. We also want to understand how it's being used to communicate too. So take that with however you need to. when we're in quiet, this is really tiny. Sorry, guys. I probably should have moved that up a little more. And I'm probably also, now that I'm thinking about it, I'm right in the way of some of these words. So I apologize. But these are all to be downloaded either on the internet or on Canvas, whatever pick your poison. When we are inquiring about a person's mood, we're obviously not observing it and coming up with our own words. So here are some questions that you can use to ask about mood, other than just how are you feeling. You may or may not be thinking about this, but some people are they're emotive and they really talk in language that uses feeling words. Other people don't have a lot of insight into their feelings, but they can rationalize and talk about things in sort of intellectual or sort of, I don't know, rational terms. So there's feelers and there's thinkers. So sometimes saying, how do you feel? And a person's like, I don't know. Well, how are your spirits? Pretty down, right? Well, they may not have used that when you asked, how are you feeling? But they might if you use a different word. So that's why there's sort of different language to get at kind of the same thing. What else do I want to say about this? There's a bunch of terms here that another book that I have here is I found in a free pile at a library or something was a psychiatrist dictionary. And in this psychiatrist dictionary, this big fat book, were a whole bunch of terms that I was like, oh, this is cool. There's a whole bunch of language that I just don't know. And some of it's Latin and some of it's words like lability or labile. And I was like, this is years ago. I was like, I don't know what that term means. And you'll come across a whole bunch of language as you're learning these things in school, reading other people's medical records, looking at reports they've brought to you from past evaluations. You'll see all these terms that are unfamiliar to you. Resist the urge to pretend like you know everything, like you know what all these words mean, and just ask the question. Ask it to your client. What does that mean to you? What does this word even mean? I don't even know what that means. Let's look it up together. It can model some humility, and it can also help you keep your ego in check, right? Just because I recognize that urge to say, like, I want to know what that means, or I feel ashamed because I'm supposed to. No, you're not. There's a lot of words out there, and people use them for different reasons. Labile, by the way, means kind of like erratic. So we're talking about affect. Fluctuations in a person's affect means their mood can go up and down. High lability means you can be happy one second, angry the next second, very sad the next second. Some people, it's strange when you see this with people with high lability, because it's like, it literally just like almost, the drop of a hat or the snap of a finger. Their moods can change. It's not like one day they come in and they have sadness. The next day they look very happy. That's a person who's relatively stable with low lability levels. So just as an example. So a bunch of questions, a bunch of words, all kinds of different information in here. I'm going to leave this up to you to dig through a little bit more. If this one looks particularly helpful, here's another one, just as a different format. I kind of like this one because it's kind of like what is this, 2-3 pages? Unlike this one, which is more focused on potentially neurological disorders, this one has just a bunch of the language in it that you could just walk through and circle. That could be potentially really helpful if you don't necessarily have to, you're at a place that wants to capture this in a quick and easy way, and this is just a form that's already been created, not like this one, which is something you'd have to like print off and just use as a resource at your desk. So this one is kind of interesting and helpful too. One of the things you notice is like in these different categories, in hygiene, there's words like average, unclean, body odor. And if I don't see a word that really fits what I want, I'll just write it in, or I'll just circle it. And I'll just, as I'm sitting with people, sometimes I've used these before. I don't typically use them all the time, but I have before. I'll go through and I'll kind of just like circle things really quickly, the ones that seem relevant to me, but I don't have to like circle everything or fill out everything. But sometimes, like, I don't often use categories like speech volume because it just isn't really relevant to any of the conditions that I care a lot about, unless a person is in like relational conflict and they're angry and they're loud and they're arguing. And so they use a louder voice. Sometimes I'll use that to talk about, to sort of to capture this picture that this person was really angry that day and they were in this, fit of confrontation or something like that. So So that might be a way to use this kind of thing. So there's a bunch here, just a different way of using it. Lots of other vocabulary in there that might be helpful. So this is a tool that I think is good to show you. And then here's another study resource, I guess, for lack of a better term. This was probably, I found this on the internet, so I assume it's free, right? Maybe it's not safe. Sorry, Heidi, if you ever see this. If you want me to pay you for this, then reach out to me, I guess. But it's telling a little bit about what a mini mental status exam is from a medical doctor's perspective, which I think is kind of interesting because you just heard me talk about it. And then you can read what Heidi has to say about it. I think we're kind of in the line for the most part. Here we see these categories again, the components of it, and then just a bunch of different language. Same kind of things you see, but some different words. You'll notice words like for rhythm, medical doctors like different kinds of language. And so if you are working in an agency or in some sort of system where you have more medical doctors around, you may think about using some of these words that might be more relevant or interesting to them because your audience is more attuned to things like dysarthria. I don't even know what that means. I'd have to look that one up. And there's a whole bunch of language in here that I think is really interesting to look at. I probably wouldn't use a lot of it, but that's just my style and my experience and my clients, and that's okay, right? So I don't think there's anything else in here that I really want to talk about all that much, and I think that's kind of the gist of all that I wanted to share, and I told you I was going to stick to 20 minutes, and we're over that just barely, so I'm going to stop it here. As we use this in our class and as we work through this, I'll explain a little bit more about how to do this in class. But I'm going to look to you to decide how you want to format these things and report them out. And I'll give you some examples of what they look like in terms of how much to write and how little to write. And then I'm just going to basically ask you questions. And if you're not in this class and or I don't get to work on this specifically with you, what I'm going to ask you, and the question that I'm asking as I'm looking at your work is I'm going to say, what does this tell me that I need to know that'll help you explain the conclusion you came to? So for example, if you're doing a clinical assessment, you're having to make a diagnosis, does the information that you put in here, using any of these tools, any of these words, does this tell me something more that I need to know that explains how you came to that conclusion in your diagnosis? If you have to, in your practice, be very efficient and say only relevant details, then you may choose to withhold more of this language. If you say, but the nuance of how this person is presenting is more specific, and this is really helpful to get this snapshot picture of why I'm saying this diagnosis versus this one, then you may want to explain a little more and use the mini mental status exam as a tool to give some of that nuanced context to sort of describe why you're wavering between one diagnosis versus another, and they present this way in person, so that's why I'm using this one and not that one. So those are the conditions in which you might be a little bit more expressive or expansive in the way you're using this kind of stuff. Okay, that's good enough. Thank you for sticking it out with me, and I will talk to you again on the next one. Yeah.